Let me ask you something. Be honest with yourself. Have you ever sat on the toilet for 30 minutes, maybe even 60 minutes, feeling like you really need to go, but nothing happens? You can feel the pressure building up, the discomfort in your lower belly, but your body just refuses to respond. In the end, you give up, walk away frustrated and tired, telling yourself, I'll try again later. But later comes and the same thing happens again and again. You feel stuck, both physically and emotionally. If this sounds familiar to you right now, I want you to type yes in the comment section below. You are not alone in this. Many people suffer silently, feeling embarrassed to speak about it. Your comment today can help the YouTube algorithm show this video to more people who need it. Let's support each other. So what is actually happening inside your body? Let me paint a simple picture for you that makes it easy to understand. Imagine a long river that has flowed smoothly for many years. The water moves steadily, carrying everything downstream without any trouble. Now, picture this. Over the course of several days or even a week, the flow starts to slow down very gradually. Maybe there was less rain, or some leaves and debris began to pile up quietly in a narrow bend of the river. The river does not stop flowing overnight. It just slows and slows until one day the debris has packed together so tightly that the water cannot pass through anymore. That river is your colon. This is exactly what happens when stool gets stuck. The medical term for this is fecal impaction, but let me explain what that really means in everyday language, because the clinical words sometimes make people think it is not a big deal. Your large intestine, also called the colon, is like a muscular tube. Its main job is to move waste material toward the exit while pulling water out of it at the same time. Normally, this process works automatically. Waste moves along, water gets absorbed in the right amount, and the stool stays soft enough to pass comfortably. But here's where aging changes everything, and I want every person watching this who is over 60 to really pay attention. As we get older, several changes happen at the same time in the digestive system. The strong muscular contractions that push waste through the colon, called peristalsis, start to slow down. The nerve signals that coordinate these movements become less sharp and efficient. Also, our sense of thirst often decreases with age, so many older adults end up mildly dehydrated without even realizing it. On top of that, many common medicines that older people take every day can slow down bowel movements as a side effect. These include blood pressure drugs, iron supplements, calcium channel blockers, and certain pain medications. When you put all these factors together, you create the perfect conditions for stool to travel through the colon too slowly. It sits in the lower parts for too long, loses too much moisture, and turns from something soft and easy to pass into something hard, dry, and almost like a brick. After 5, 6, or even 7 days without a complete bowel movement, it becomes a dense, solid mass. When that mass reaches the rectum, the final storage area just before it leaves the body, and it simply cannot fit through the opening, you now have a fecal impaction. The pressure and discomfort you feel are very real. The exhaustion from repeated straining is real, and the worry that something is seriously wrong is completely justified, because it is. If you are learning something useful right now, take 1 second and hit the like button. It helps the video reach more people. Let us move to the next important part, why this condition is far more dangerous than most people realize. A lot of people hear the word constipation and think it is just an inconvenience, nothing to worry about. But a real fecal impaction is not the same thing at all. Let me walk you through what starts happening in your body when a large, hardened mass stays stuck in the rectum for a long time. The first problem is the physical pressure. Your rectum is flexible, but it has limits. When it stays overstretched by this hard mass, the blood supply to the delicate tissue lining the walls can become reduced. The cells in that lining need steady oxygen and nutrients from the blood. If circulation is cut off or slowed for too long, those tissues can get damaged, and in serious cases, they may need medical help to heal properly.
Here's something that surprises many patients when I explain it. Your rectum and your urinary bladder sit very close to each other in the same small space in the pelvis. They're separated by only a thin wall. When the rectum is packed full and stretched out, it pushes directly against the bladder. For women, this pressure can feel even stronger because of the way the pelvic organs are arranged. Patients often suddenly have trouble urinating. They feel like they need to go all the time, but only a few drops come out, and it can be painful. Some people even lose the ability to urinate properly. I have seen patients come to the clinic thinking they had a sudden bladder infection, when the real cause was the rectal impaction pressing from behind. Once the impaction is cleared, the urinary problems usually disappear quickly. But we're not finished yet. There's one more symptom I must warn you about because it confuses so many people and leads them to make the situation much worse. It's called overflow incontinence. On the surface, it looks exactly like diarrhea. Here's what's happening. The solid hard mass blocks the main exit, but your intestines keep producing liquid waste from higher up. That liquid has nowhere to go, so it seeps around the edges of the blockage, like water leaking around a dam. It comes out unpredictably and can stain your clothes. Many people see this liquid and think I must have diarrhea, not a blockage. Then they go buy anti-diarrheal medicine from the store. This is one of the most dangerous mistakes you can make. Those medicines slow down or stop the intestinal muscles completely. They paralyze the very movement your body is trying to use to work around the problem, and the impaction becomes even more stuck. I strongly recommend you save this video right now. You may not need these steps today, but if this ever happens to you or a loved one in the future, having this clear guide could prevent panic and help you act wisely. If you're seeing what looks like diarrhea but you haven't had a full bowel movement for several days, consider that it might be overflow instead of true diarrhea. Do not take medicine to stop it without talking to a doctor first. Now, let's talk directly to my older adult viewers. Why are seniors at much higher risk for this problem?
The statistics are serious and not talked about enough in regular health videos. Fecal impaction does not affect everyone equally. It hits adults over 65 much harder, and the risk keeps rising with every decade after that. In nursing homes and long-term care places, studies show it can affect up to 40% of residents at any time. It is one of the most common digestive emergencies in older people, yet it is also one of the most preventable if you understand the causes. Here are the major risk factors for people over 60. Reduced mobility is a huge one. When we walk, exercise, or even do light housework, it creates gentle pressure in the belly that helps keep the intestines moving. If mobility drops because of arthritis, surgery, a fall, or general weakness, that natural help disappears, and the colon slows down. Dietary changes matter too. Many older adults eat smaller meals, take in less fiber, and drink less water. The thirst feeling becomes weaker with age, so dehydration creeps in quietly. All this makes stool drier and harder. Then there are medications. This is so important that I encourage every person over 60 to sit down with their doctor or pharmacist and review their pill list. Many common drugs have constipation as a side effect. Opioid pain relievers, some antidepressants, antihistamines, iron pills, calcium supplements, and diuretics. When you take several of these together, the constipating effect adds up and becomes strong. Finally, there is the habit of suppression. Many older people grew up when talking about bowel movements was considered private or even shameful, so they hold it in when they are not at home or when it is not convenient. Over years, this retrains the rectum to ignore the signal. The urge becomes weaker and waste sits longer than it should. Knowing your personal risk factors is the first big step to preventing this from repeating. Before we go into the exact action steps, make sure you are in a quiet place where you can focus, because what comes next could help you avoid an emergency room trip. Here's the emergency action protocol if you are stuck right now. First and most important, stop straining hard. I know your body wants you to push, but a dry, rigid mass does not move with pressure from above.
Extra straining only raises the chance of hemorrhoids, small tears, or even a sudden drop in blood pressure that can make you faint. In older adults with heart issues, it can put extra stress on the heart, so breathe calmly and follow these steps instead. Step 1. Use glycerin suppositories. You can buy adult ones at any pharmacy without a prescription. For a true impaction, one may not be enough. Many times, 2 or 3 adult suppositories are used together. Lie on your left side. This position matches the natural curve of your colon. Use plenty of water-based lubricant on each one. Insert them gently and deeply. Then stay lying still on your side for a full 30 to 45 minutes. Set a timer. The glycerin draws moisture into the mass and lubricates the area, but it needs time to work. If you get up too soon, you may just lose the suppository with no real progress. Step 2. If nothing major passes after the first try, do not lose hope. Get up slowly and walk gently around your home for 15 to 20 minutes. Light movement wakes up the intestines. Then lie down again and repeat the suppository process with another 30 to 45 minutes of waiting. Step 3. If 2 rounds of suppositories do not help enough, move to a warm water or saline retention enema. These are available over the counter. Follow the package instructions carefully. Lie on your left side, administer slowly, and try to hold it for as long as possible. The warmth and fluid help soften and loosen the mass from above. Step 4. If you have tried these steps thoroughly and still have no success, it's time to go to urgent care or the emergency room. This is not giving up. It's a smart choice. At the hospital, they can use stronger medicated enemas, take x-rays to see exactly how big the problem is, and, if needed, perform manual disimpaction. This means a doctor, using gloves and lots of lubricant, carefully breaks up and removes the mass piece by piece. It's usually done with sedation so you're comfortable. The relief afterwards is often huge and immediate.
Once the impaction is cleared, your body enters a short recovery time. For the first 24 to 48 hours, the rectal area may feel irritated, swollen, or raw. You might see a little spotting. This is normal and should improve. Take warm sitz baths, just sitting in a few inches of warm water for 10 to 15 minutes, 2 or 3 times a day. This soothes the area and helps healing. For your diet in the first few days, choose soft, easy-to-digest foods with some fiber and moisture. Oatmeal, ripe bananas, vegetable soups, cooked carrots or applesauce. Avoid dry, tough, or fried foods. Drink water steadily throughout the day, even if you do not feel thirsty. This is also the perfect time to make doctor appointments while the experience is fresh. Talk to your primary care physician about your current medications and any that might be causing constipation. If this has happened more than once, ask for a referral to a gastroenterologist to check your colon motility. And if it has been a while since your last colonoscopy, schedule one to rule out any structural issues like narrowing or growths. Finally, let us talk about the most important part, long-term prevention, so this crisis never returns. What we covered so far is crisis management. The real goal is building habits that keep your digestive system healthy for years. Prevention rests on 4 main pillars. Pillar 1 is hydration. Water is the best friend your colon has. Aim for at least 6 to 8 glasses every day. If plain water is boring, try warm herbal teas, clear broths, or eat fruits and vegetables that are full of water, like watermelon, cucumbers, and oranges. Set phone reminders if you need help remembering. Pillar 2 is daily movement. You do not need intense exercise. A gentle 20 to 30-minute walk each day can dramatically improve bowel function. The motion creates natural pressure that keeps things moving. If walking is difficult, try seated exercises, stretching, or swimming in a pool. Pillar 3 is consistent diet. Focus on soluble fiber from oats, beans, lentils, apples, pears, and cooked vegetables. This type of fiber holds moisture and adds gentle bulk. Introduce extra fiber slowly over weeks so your body adjusts without gas or bloating. Also, try to eat meals at roughly the same times each day so your intestines get into a healthy rhythm. Pillar 4 is a bathroom routine. Your body has a natural gastrocolic reflex, a signal to have a bowel movement after eating, strongest in the morning. Sit on the toilet 30 to 60 minutes after breakfast every single day, even if you do not feel the urge yet. Place a small footstool under your feet to raise your knees. This straightens the rectum for easier passage. Give yourself 5 to 10 minutes without phones or rushing. Over time, your body will relearn the rhythm. One important warning: do not depend on strong stimulant laxatives every day for long periods. They give fast results, but daily use can make the colon lazy and dependent. When you stop them, it becomes even harder to go naturally. This is called cathartic colon. Instead, work with your doctor on safer long-term options like stool softeners, osmotic laxatives, or daily fiber supplements. I know today's conversation was long and touched on topics that are not easy to discuss, but the most valuable health talks are often the ones that feel personal or uncomfortable. You deserve to understand what's going on in your own body. You deserve clear steps when things go wrong, and you deserve to know you do not have to face this alone or feel ashamed. If this video gave you helpful information, please do 3 things. Hit the like button, subscribe to the channel for more videos on aging and digestive health, and share it with a family member, friend, or neighbor who might be struggling quietly. This could be exactly what they need. Tell me in the comments, what is your age and one digestion challenge you are facing? I read every comment and reply to as many as I can. Take care of yourself, drink your water, move your body gently, and I will see you in the next video.